Our approach to community leadership is a very collaborative one. And as a result, we do nothing alone. And it is only through a collaborative approach to community leadership that we can find shared solutions to any issue, let alone a complex social one. The mental health crisis was evident to everyone, but mainstream philanthropy wasn't really addressing it. And we debated whether or not we should try. Insight Region, our Center for Data and Research, started with a report looking at the data and the extent of the issue. And we dedicated our annual Shape of the Region conference solely to the topic of mental health as well. One of our panelists at that event was Dr. Sandy Chung, a local pediatrician. But she launched a program several years earlier called VMAP, which is essentially a training program for general health practitioners to learn how to do an intake protocol for patients that are presenting with some mental health needs for the purpose of earlier intervention. We weren't the only funder in the room that day. There were others listening to Sandy Chung, and a group of 18 funders later came together to form the Virginia Funders Cohort that is focused on expanding the VMAP program across the entire Commonwealth of Virginia.
VMAP has saved many lives. For example, I had a patient, a 14-year-old, who had bipolar disorder, whose child psychiatrist had retired, and he couldn't get access to care. At the time, VMAP didn't exist, and that young man ended up shooting someone in a fight because his disease had gotten out of control. He ended up in the juvenile justice system. That other man lost his life. Had VMAP existed, that wouldn't have happened. And we know today that there are children all over the Commonwealth who are getting access to care within 30 minutes. That is so different than the way it used to be, that we know we're helping families and we're helping children every single day.
Mental health is a huge issue. It's hard to know where to even start addressing it. But if we've learned anything, it's that philanthropy has a meaningful role to play in raising awareness and in improving access to mental health services.
The Community Foundation for Northern Virginia was essential in order to expand VMAP and its reach. The efforts that they had, including the Shape of the Region conference, was essential in bringing together stakeholders who were interested in youth mental health. And by bringing together multiple foundations, we were actually able to be more impactful and reach more children than we could with one foundation alone.